Hi, I'm Dr. Michael Doyle, and I'd like to speak to you for a minute about one of my all-time favorite doctors and his book. That's Dr. William McK Jefferies and his book, The Safe Uses of Cortisol. This book, the third edition, was published, I believe, 1903, or sorry, 2003. Dr. Jefferies was an old-timer, but not that old. At that point, I think he was just about 90 when he published the third edition. But Dr. Jefferies was a Harvard research fellow in the 1940s when cortisol, or hydrocortisone, was first discovered. Unlike his colleagues, he recognized that this was a crucial hormone that needed to be kept in a healthy balance within the body. At the time, they discovered that hydrocortisone could reduce inflammatory conditions like rheumatoid arthritis, so the doctors were giving massive doses, seeing great response, and then seeing that their patients would die. The problem was they were using way too much. Now, too much of anything can be harmful. Too much hydrocortisone is no exception. Dr. Jefferies realized this was a natural hormone and that we needed what he called physiologic doses. You needed to give the body the amount that it needed to restore a healthy balance and to be able to, maintain normal blood pressure, fight infections, reduce inflammation, etc. Under stress, he noted that people needed a lot more of this. And then when the body got things under control, lower doses were used. This is typical of what other doctors have done in a sense in general, but Dr. Jefferies used lower doses and used the natural hormone hydrocortisone consistently. And he proved over the course of his 50-year career that this could be extremely safe and effective. He treated autoimmune diseases, chronic fatigue problems, infertility. In fact, he used hydrocortisone for over 200 cases of infertility where the women went on to have healthy babies. So Dr. Jefferies accomplished quite a bit. Now, over the year, science has supported his case, showing that hydrocortisone, or at least corticosteroids, usually they do just touch on the synthetic versions, which are apparently probably less safe and have never been proven to be any more safe. But even the synthetic forms have been shown to be safer, for instance, than taking Motrin on a regular basis. They used, if you use low enough doses. Now, the problem was that the doctors were using pharmacologic doses. Dr. Jefferies recommended physiologic doses, and these low doses have been shown to be actually quite safe. And in addition, Dr. Jefferies recognized that the hydrocortisone needed to be kept in a healthy balance with other hormones, namely thyroid and DHEA. And if you do that as a doctor, you're actually going to get additional benefits and additional safety by maintaining a healthy balance rather than throwing things out of balance in order to eliminate one symptom. So Dr. Jefferies, great man, great physician, published in over 27, I think 27 peer-reviewed medical articles, a couple of the major endocrinology books of his day, and wrote his book and published 3 editions of that. So Dr. Jefferies was well aware that if you're suffering from things like autoimmune disease, chronic fatigue, chronic recurrent infections, low blood pressure, dizziness, anxiety, palpitations, you should consider the fact that you might have a cortisol deficiency, and that if you do, treatment with low-dose hydrocortisone can be very safe and very beneficial. If you want to learn more about this type of approach, you can track down Dr. Jefferies' book, or you could take a look at my website, www.gotodrdoyle.com. Thank you very much.